want to talk about the difference between a mini facelift and a full facelift. This is the most commonly asked question when everyone's coming in and asking about different ways to refresh their face. It's a very confusing question, and I bet you if you ask 10 different surgeons, they might give you 10 different answers. The best way I can describe this to you is the difference between a full and a mini is how many areas we're addressing. And for me, since I do everything as a deep extended plane facelift, it's how many areas I'm addressing and how many ligaments I'm releasing. So the simplest terms, most commonly folks are asking for a mini facelift. In my practice, they're bothered by their neck and their jowls. So you're really tightening and restoring the angle of the jaw here and deepening the neck and getting any folds out. When I'm only addressing these areas, I'm only addressing this bottom half. The incision can actually stop and be hidden within your ear itself. It makes a big difference because the healing from that within a week when the sutures are out, folks are walking around, nobody even knows the wiser that it's happened because the incisions are so well hidden. There is another type of mini facelift that I do, which is just the upper part of the face that I typically combine with the brow, which is avoiding incisions around the ear altogether, and I'm able to address it from up here in the hairline. It's more of a temporal type of lift, and it's really only addressing the upper part. But if I'm doing a full facelift, that means I'm addressing all of it at the same time. And commonly those patients are having an incision that goes beyond the ear, whether I'm having to trace it up into the hairline or even in front of the hairline, depending on their wishes and their existing hair. But you can break it up however you want, as long as you think about it as bottom half and top half of the face. And hopefully that gives you some clarity as far as the difference between a mini lift and a full lift and where the incisions are going to be and which areas are being addressed. Thanks.